Hypoplastic left heart syndrome. Underdevelopment of the left side of the heart, obstruction to blood flow from left ventricle outflow tract, underdevelopment of the left ventricle, aorta, and aortic arch, mitral atresia or stenosis, co-artication of the aorta. Manifestations occur early in newborns, cyanosis, tachypnea, decreased cardiac output, fatal in early life if untreated. Acquired cardiovascular disorders occur after birth, various causes, infection, genetic disorders, autoimmune process or disease, environmental factors. Kawasaki disease, formerly known as mucocutaneous lymph node syndrome, acute self-limiting systematic vasculitis that may result in cardiac sequela, usually occurs in children under 5 years of age and in winter or spring. Pathologic stages. Stage 1 is 1 to 12 days. Capillaries, venules, arterioles, and the heart become inflamed. Stage 2, 13 to 25 days. Inflammation of larger vessels, coronary aneurysm appear. Stage 3, 26 to 40 days. Medium-sized arteries begin granulation process. Stage 4, 41 days and beyond. Inflammation wanes, scarring of vessels, calcification, and stenosis. Diagnosis, 5 of 6 major findings. So a fever for more than 5 days unresponsive to antibiotics, bilateral conjunctivitis without exudation, erythema of oral mucosa, so the strawberry tongue, changes in the extremities such as peripheral edema and erythema with desquamation of palms and soles, polymorphous rash, cervical lymphotomy. Why can't I say that? Lymphopathy. Systemic hypertension. Systolic and diastolic blood pressure over the 95th percentile for age, gender, and height on at least 3 occasions. Hypertension in children differs from adults, often has an underlying disease such as renal disease or coarctation of the aorta. A cause is almost always found. Children are commonly asymptomatic. See an increased incidence of primary hypertension in older children related to obesity. Pediatric pulmonary disorders, so RSV and asthma. Asthma is characterized by bronchial hyperreactivity and reversible airflow obstruction, usually in response to an allergen. Most prevalent chronic disease in childhood results from a complex interaction between genetic susceptibility and environmental factors. Manifestations: cough, expiratory wheeze, shortness of breath, tachypnea, nasal flaring, use of accessory muscles, exercise intolerance. Therapy goal is to achieve long-term control. RSV. Nothing there. Roles of angiotensin 1, 2, renin, and aldosterone. Pathology of an MI. Extended obstruction of the myocardial blood supply, causing myocyte necrosis. It's a STEMI or non-STEMI. subendocardial or transmural interaction. Structural changes: myocardial stunning, hibernating myocardium, myocardial remodeling. Manifestations: sudden severe chest pain may radiate, nausea, vomiting, diaphoresis, dyspnea. Complications: sudden cardiac arrest due to ischemia, left ventricular dysfunction, and electrical instability. Ischemia. Atherosclerosis, thickening and hardening caused by accumulation of lipid-laden macrophages in the arterial wall. Plaque development. Risk factors include diabetes, smoking, hyperlipidemia, dyslipidemia, hypertension, autoimmunity progression, inflammation of endothelium, cellular proliferation, macrophage migration and adherence, LDL oxidation, they foam cell formation, and a fatty streak. Fibrosis plaque, complicated plaque, results in inadequate perfusion, ischemia, necrosis. Coronary artery disease, any vascular disorder that narrows or occludes the coronary arteries, leading to myocardial ischemia. Atherosclerosis is the most common cause. Primary cause of heart disease in the U.S., conventional or major risk factors, non-modifiable, increased age, family history, male gender or female gender post-menopause. Modifiable, dyslipidemia, hypertension, cigarette smoking, diabetes and insulin resistance, obesity, sedentary lifestyle, atherogenic diet. Non-traditional risk factors, markers of inflammation and thrombosis, so high density C-reactive protein, troponin 1. Adipokines, chronic kidney disease, air pollution and ionizing radiation, certain medications, microbiome. Transient myocardial ischemia. Local temporary deprivation of coronary blood supply, stable angina, Prinzmetal angina, silent ischemia and mental stress-induced ischemia, acute coronary syndromes, unstable angina, results from reversible myocardial ischemia, myocardial infarction. Valvular heart disorders. Valvular stenosis, aortic stenosis, narrowing or stricture of the outlet of the LV causing resistance of blood flow from the LV into the aorta. Mitral stenosis, sometimes called mitral stenosis, is a narrowing of the valve between two left heart chambers. The narrowed valve reduces or blocks blood flow into the heart's main pumping chamber. The heart's main pumping chamber is the lower left heart chamber, also called the left ventricle. Valvular regurgitation, aortic regurgitation. Aortic regurgitation is the inadequate closure of the aortic valve during diastole that results in reverse blood flow through the aortic valve. This condition can occur as a native valvular disease or as a result of aortic root dilation. Mitral regurgitation, a type of heart valve disease in which the valve between the left heart chambers doesn't close completely, allowing blood to leak backward across the valve. Tricuspid regurgitation, a type of heart valve disease that occurs when the valve's flaps, cusps, or leaflets do not close properly. The tricuspid valve controls the flow of blood from your heart's right atrium, top chamber, to the right ventricle, bottom chamber. Mitral valve prolapse syndrome, one or both cusps of the mitral valve billow upward into left atrium during systole. Mitral regurgitation if blood leaks into the atrium. Patients can be asymptomatic or have vague symptoms. Systematic inflammatory disease caused by a delayed immune response to pharyngeal infection by the group A, B hemolytic streptococci. Febrile illness, inflammation of the joint, skin, nervous system, and heart if left untreated, may cause rheumatic heart disease. Common manifestations: fever, lymphadenopathy, arthralgia, nausea, vomiting, and abdominal pain, tachycardia, epistaxis. Major clinical manifestations: carditis, polyarthritis, chorea, erythema marginatum, subcutaneous nodules. Endocarditis, inflammation of the endocardium. Agents: bacteria, virus, fungi, rickettsial, parasites. Pathogenesis: damaged, prepared endocardium, blood-borne microorganisms, adherence, proliferation of the microorganism, vegetations. Classic findings: fever, new or changed cardiac murmur, petechial lesions of the skin, conjunctiva, or oral mucosa. Characteristic physical findings: Osler nodes, Janway lesions, other, weight loss, back pain, night sweats, and heart failure. Heart failure. Heart failure is unable to generate adequate cardiac output, inadequate perfusion of tissues. Increased diastolic filling pressure of left ventricle. Pulmonary capillary pressure increases, systolic heart failure. Ejection fraction less than 40%. Inability of the heart to generate adequate cardiac output to perfuse tissues. Stroke volume, contractility, preload, afterload. Distributions: decreased cardiac output. Falling cardiac output progressively worsens heart failure. Manifestations: dyspnea, orthopnea, cough of frothy sputum, fatigue, decreased urine output, and edema, pulmonary edema, hypotension, hypertension, S3 gallop. Left heart failure, diastolic heart failure, pulmonary congestion despite normal stroke volume and cardiac output. Major causes include hypertension-induced myocardial hypertrophy and myocardial ischemia. Induced ventricular remodeling, decreased compliance of left ventricle, abnormal diastolic relaxation. Manifestations: dyspnea on exertion, fatigue, pulmonary edema may develop over time, S4 gallop. Right heart failure, inability of right ventricle to provide adequate blood flow at a normal venous pressure. Can result from an increase in left ventricular filling pressure that is reflected back into the pulmonary circulation, most commonly caused by a diffuse hypoxic pulmonary disease. High output failure, inability of the heart to supply the body with blood-borne nutrients despite adequate blood volume and normal or elevated myocardial contractility. Causes include anemia, hyperthyroidism, septicemia, and beriberi. Shock. Cardiovascular system fails to perfuse the tissues adequately, leads to impaired cellular metabolism, impaired oxygen use, impaired glucose use. Manifestations based on type often include feeling weak, cold, hot, nauseated, dizzy, confused, afraid, thirsty, short of breath. Hypotension, tachycardia, increased respiratory rate. Types are classified by cardiogenic heart failure. Hypovolemic, insufficient intravascular fluid, hypovolemic shock. Neurogenic, neural alterations of vascular smooth muscle tone, neurogenic shock. Okay. Obstructive lung disease, narrowing of airways resulting in airway obstruction that is worse with expiration. Accessory muscle of expiration required. Increased work of breathing, dyspnea and wheezing. Asthma, chronic inflammation of the airways causes bronchial hyperresponsiveness, constriction of airways, and reversible airflow obstruction. Pulsus paradoxus, status asthmaticus. Symptoms include expiratory wheezing, dyspnea, and tachypnea. Peak flow meters, corticosteroids, beta agonist inhalers, and anti-inflammatories used to treat. COPD, characterized by persistent airflow limitation, usually progressive. Most common chronic lung disease in the world. Risk factors: tobacco, smoke, occupational dust and chemicals, air pollution. Any factor affecting lung growth during gestation and childhood. Bronchitis, hypersecretion of mucus and chronic productive cough that lasts for at least 3 months of the year and for at least 2 consecutive years. Inspired irritants increase mucus production and the size and number of mucus glands. The mucus is thicker than normal. Bronchial dilators, expectorants, and chest physical therapy is used to treat. Empyema, abnormal permanent enlargement of the gas exchange airways accompanied by destruction of alveolar walls without obvious fibrosis. Inherited deficit or alpha-1 antitrypsin. Loss of elastic recoil, air trapping. Respiratory tract infections. Acute bronchitis, acute infection or inflammation of the airways or bronchi, commonly follows a viral illness. Acute bronchitis causes symptoms similar to those of pneumonia but does not demonstrate pulmonary consolidation and chest infiltrates. Pneumonias, lower respiratory tract infection caused by bacteria, virus, fungi, protozoa, or parasites. Type: community acquired or CAP, Streptococcus pneumoniae, influenza. Health care acquired, HCAP. Ventilator associated, VAP. Tuberculosis, infection by Mycobacterium tuberculosis, leading cause of death from curable infectious disease in the world. Airborne transmission, tubercular formation, caseous necrosis, tuberculin skin test. ARDS, acute respiratory distress syndrome, acute lung inflammation and diffuse alveolo-capillary injury that results from injury or severe inflammation. Bilateral infiltrates on the chest radiograph. Low ratio of PaO2 to FiO2. 3 phases: exudative within 72 hours, proliferated 4 to 21 days, fibrotic 14 to 21 days. Manifestations: dyspnea and hypoxia despite supplemental oxygen. Hyperventilation and respiratory alkalosis, decreased tissue perfusion, metabolic acidosis and organ dysfunction. Increased work of breathing, decreased tidal volume and hypoventilation. Hypercapnia, respiratory acidosis, respiratory failure, decreased cardiac output, hypotension, and death. Pneumothorax, open pneumothorax, tension pneumothorax, spontaneous primary pneumothorax, secondary pneumothorax. Pleural effusion, fluid in the pleural space. Transudative, which is watery. Exudated, WBCs and plasma proteins. Hemothorax, blood. Empyema, pus. Chlorothorax, chyle. Chest wall disorders, chest wall restriction, compromised chest wall, deformation, immobilization, and or obesity. Flail chest, instability of a portion of the chest wall.